Let's see, where's my... Okay, everybody can still hear me?
Yes.
Yes, okay, great. All right, well, my name is Kali Klaver. I think most of you have met me, and if not, hello. And I am the nurse residency coordinator. So we have been kind of brainstorming with ways to improve our residency program for 2022. Some changes that needed to come up just because of how things went during the last year. And I feel like we're finally at a place where we can make some changes with everything that has happened during COVID and all the limitations we were challenged with. So hopefully 2022 is the year. I saw a meme that said, nobody go into 2022 touching anything or saying anything, and don't mess it up. So true. Don't claim this as your year. It was funny. But okay, so those in the room have an agenda in front of them, but for those online, here's our agenda that we'll discuss. So I sent out the policy. We'll just review some of that and some updates and feedback I got from that. I have two proposals, cohort model, and then a committee member unit champion pilot that I'll present, and then we can have some discussion about that. So for our reflection today, unity is strength. When there is teamwork and collaboration, wonderful things can be achieved. I just thought that was good because we really, as an education department, have come together a lot and collaborated and have a really strong team anyway, but have collaborated to make this residency program, I feel, stronger. So just getting every unit on board, I guess, with that. So here are some, I don't know what this little thing in the middle is. Oh, I can maybe X that out. Here's just some data, I guess, that I collected so you can have some visual aid of what has been going on. So spring 2020, that was with the residents that graduated this January of 2021. 69% completion rate. And so then you can see summer, fall, and then our spring 2021, those are our residents that are due to graduate in January. So every cohort has a 60% or more, which I feel is a good completion rate. Hopefully we can continue to keep that there or improve. Our current enrollment for summer 2021 and fall 2021 is 80 and 70. Our spring enrollment pretty good, right? Our spring enrollment for this next cohort to start, there's still a lot of pending boards, so I didn't include those numbers because it's just very questionable still. 7. Great. And I think Abby has a lot too. 11, yeah. Yeah, that's a lot. I know. And then just some feedback from the residents that we always do an evaluation, so it's kind of nice to see what their feedback is. So that is below there. I think some of the takeaways, they definitely love simulation, and we've really tried to do our best to incorporate more hands-on simulation. We have those high-definition mannequins that we're able to use, and we're learning more about those as the education department. So we keep asking them to bear with us so we can make it better for you as we are learning too. So I think it's really fun though for them to be able to do some more hands-on with that.
Do you have the data on people that just graduated?
Yeah.
Did they leave institution?
I do.
Like not graduate?
I do have it. I don't have it on this.
So it's wrong.
Yeah.
I'm wondering, what gets a person kicked out of residency? I know going PRN.
Yeah.
But
so
I quit it.
For those online, the question was, do you have the data for those that didn't graduate or what happened to them? A lot of them did leave the organization altogether. Some did transfer, and those were counted in the numbers that didn't graduate because they didn't complete the program, but they maybe were still enrolled here or employed here at Mercy. And then others, there's some, I mean, just leaving the organization really was the big one. Moving or changing jobs to like a clinical setting or something like that. But would you like that information? I can send that out. Sure.
Was that 6 to 9 months?
Yeah,
The time?
yeah. It is. The 6 to 9 months is kind of the high turnover rate for, I think, all areas. There we go. Okay, so policy. I did get some feedback. Some of the feedback, well, most was good, so that's a approval of the policy, which is great. Some feedback was, do I need to be in every meeting that is held with, like if there was absences, just because it's a lot of coordinating with the nurse educator, the director, and the resident themselves. I feel like it can be variable, but I do feel like I present them the information on day one. So having that face to kind of enforce that on their second absence or whatever, I think is important. If you want to have a meeting, if I'm not able to be there, you can fill me in. That's just fine too. But I think I would like to be there just so I can continue to carry that message and it's consistent.
Can I say something about that?
Yeah.
The reason I provided that feedback, I don't know if other people did, I just don't want, when it's written in policy, and like if Amber and I meet with somebody, and you weren't there, let's say, if somebody grieves that, like if I hire them because they didn't pass residency, and they grieve that, and you weren't there, like I don't want that to be a loophole, that, you know what I mean? So like I'm not at all opposed to like including you or anything like that, I just didn't know if that like had to be in policy that you are there, because otherwise you're gonna be at a lot of 7:30 meetings with these night shift staff, you know what I mean?
Yeah.
And there's a lot of people in all the different residencies, so that's where I was coming from.
Did you guys all hear Abby?
Sort of.
Was that a yes or a no? I'm sorry.
I wasn't able to hear.
Okay.
No.
So the question was just that in policy, don't want to have it be a loophole if the employee was terminated from an absence of, not being present at residency. And if it's written in policy that I am supposed to be at those meetings and am not there, that they might present that as a grievance of some sort. So maybe the wording could be adjusted as far as could include, but not required or something like that. All present limit, or what's the wording I'm looking for? Exceptions maybe to who's present. That's a good. I think that's.
I feel like there's a lot of people for you to manage, and a lot
Yes.
of people to meet up with, and if you're going to dig yourself into a hole if you have to be there at every single one, you know what I mean?
I agree. I think that's good that's why I wanted you guys to review these, because I don't want to have a loophole there. We want to have a policy that's going to be, black and white and not, a lot of gray area. So thank you for that feedback. Thank you. And then the other one was, do I need to be notified? All three. So director, CES, and nurse residency coordinator need to be notified of absences. So I don't think necessarily. We included that I think when the policy was originally created, because if they at least would contact one of the people, then they were okay. But in the policy, I don't think it says anything like it won't be accepted if you don't notify all three. I think, and I'll word it differently too, just to read, so that they should notify one of the following: me, you, or the nurse educator. But yeah, I think that's another. They don't always notify everybody, but we want to make sure that they're notifying somebody so that they don't count as a no call, no show. And then the third feedback was, an action plan. So an action plan is new to the policy, that if nurses have 2 or more absences, we want to have something documented as far as we talked to you. You've been notified that if you have more absences than 3, you could be terminated from the organization and not complete residency. So the action plan was just to have something written down. I do think, though, that the nurse should come up with their own action plan of how they're going to improve and how they're going to meet the expectations of residency. And that was the feedback, was that the nurse should create their own action plan, and I agree with that. So those are the changes that I was provided with. Does anybody have any other revisions that they want to bring up? Okay, I'll make those edits and resend it out, and you guys can review that again and vote on that. Okay, so our current residency state or situation, we have 4 hours, one time per month, 11 sessions, and then that 12th session includes graduation, 3 cohorts, spring, summer, and fall, and then specialty content focused for med-surg, critical care, ED, and maternal child services. Right now, we don't have a project requirement for completion of the program or graduation. Our history on residency is that they used to be an 8-hour day, 1 time a month. There was 2 different programs. There was either a 3 cohort or a rolling cohort, depending on when they started residency. Previously, they would do core content for 4 hours and specialty content for 4 hours. Then they would do an evidence-based project that was implemented into the curriculum that month 8, 9, 10, and 11, they had time to focus on and complete. They would present their project at graduation, and that would be part of like their requirement to attend and present. So what we have identified as a gap, and we're trying to brainstorm on ways to fill this gap, but currently we have a 4-hour curriculum that's just specialty focused. We don't have evidence-based practice project requirements for completion of the residency program. There is noted lack of involvement on units for champions and committees, council members, so resulting in poor quality metrics across the organization just because they're not owning their own practice. We do also see large cohorts, so we'll get to that. But then we see residents beginning at inappropriate timing for their specialty. Some are starting after orientation, which isn't beneficial for a lot of the med-surg residents, and some are starting while on orientation, which isn't always beneficial for the critical care emergency department residents. So what we have come up with in our vision or whatever for 2022 is that we would still continue the 4-hour sessions with specialty content, but then we want to include some core content in months 1, 2, 6, and 11. We've kind of created those agendas to include everybody. So this would bring all residents within that cohort together. They would be residents from mom, baby, all service lines that we serve. Then we are recommending that we increase to 4 cohorts. So we would start every 3 months, but only having 1 residency session per week per cohort. So right now, MedSurg Tele has Tuesday, Thursday within each cohort, and we would just want to do 1 day for each cohort, but then add a 4th. Is everybody following me? Okay, I'll give you the visual in just a second. And then our other recommendation is that we want residents to become involved in a committee. We want them to be a unit champion. This would just help to improve key metrics and key results and quality metrics. We want them to educate and mentor coworkers and own their own practice. I think sometimes we think if we wait until residency is over, maybe they will take that on, but we have found that that's not really the case. And so if we can get them while they're fresh and green and kind of make it a culture change that they're just involved in something right away, right up front, right off the bat. Maybe if we try something like this, that might get more people involved and, like change the culture, I guess, of when we are asking them to become involved. Yeah. Yes, okay. So we did present this to the committee leaders that are involved. So like the CAUTI, sepsis, Lori Kennedy with safety. We did present this to them, so at least we would know that they would be willing to mentor these residents, and they're absolutely on board. And so we would want the residents to feel like they have an extra layer of support from those committee leaders. Those leaders are going to kind of take them under their wing and guide them to improve our quality metrics and key results and be impactful for our patient outcomes. Was that kind of, did I kind of hit on all of the pieces that we talked about before? Okay, so I'll talk a little bit more about all of this in a second, but to break down each proposal. So first, the cohort. So 4 cohorts, like I mentioned, inconsistency with resident starting dates just based on their hire date. So if we increased our cohorts to 4, starting every 3 months instead of starting every 4 months, hopefully we'll hit those people more at more appropriate timing for both service lines, all service lines. This new cohort proposal would only be for critical care med surg, just because the maternal child service lines don't have as high of enrollment for residency. And if that would change, we would already have the cohort in place and they could just join. The new cohort would be named spring, and the current spring would be changed to winter. So we would have a winter that would be starting February 10th, like the normal spring would be starting. And then, so I have handouts for you guys so you can have a little visual. And for those online, I'm going to open up what we're all looking at. So currently what we have is Med-Surg Tele is Tuesday, Thursday, every single month. Every other service line is just on Thursdays. So instead of the Tuesday, Thursday, we would just, and I'll show you this here just a second. Sorry, it's hard to run Zoom and talk at the same time. But just for a visual, this is what the calendar that you guys have already gotten looks like. Yeah, every single cohort for Med-Surg Tele is Tuesday, Thursday. So then what is proposed, it's not increasing the work for Med-Surg Tele like dates, because we were able to figure out a way to align it to start on, the new cohort would start on Tuesday, which is what Med-Surg Tele is already used to. It would change the workflow for critical care and emergency, just because they would then have 2 residency dates in 1 week. However, we still wanted to have that last week of the month for prep for residency, any additional meetings that we need to have. That it just gives us that week of breathing, I guess, that we already are currently used to, which is really, really nice. And then a lot of times holidays fall on that last week of the month. So it was a nice balance of not having to finagle with holidays and everything like that. So then this is what the calendar would look like for 2022. Rooms would already be reserved because I had already reserved them for Med-Surg Tele's residency schedule. So that is the, I guess, proposal for the four cohorts. And I'll give you guys an opportunity to give me your feedback at the end of this presentation via survey. Does anybody have any questions?
I do, just regarding scheduling. When we send such large numbers, there's no way I can schedule and send residents on just one day.
Okay.
I'm gonna have to pick and choose who can go.
So the question or concern, I guess, is scheduling and sending large amounts on just having one day of the week. So I'm hoping that with the 4 cohorts, we have less. That's my hope. And I can see your concern with that, just because we do see a lot of residents. I think one day right now we have 6 from one unit.
I'm trying to split mine pretty evenly, but it's still even challenging just sending 3 or 4. Because I just have to take transportation.
Yes.
Is this in place of work hours on the floor?
No, they work there 36 hours and then,
So they just
expected they do 40 hours a week or
Yeah.
residency.
Okay. So just have one day out of the week to block out, you can't schedule.
And most of my night shifts don't like to, some of them will work like the night before and for the residents in the morning, but otherwise don't like to work.
Yeah. That's what we do too. I
Either
do
day.
experience stuff, yeah, I do too.
Yeah. Which is why we went for 4 hour session, it makes it easier.
Yeah.
For part of the.
Yeah. Anybody online have any feedback or concerns, or maybe advice on how to schedule or advice on how this could work? I do see your concern.
But we're finishing out everybody that's already in.
Yep.
We're not really.
So the new one that's starting this spring would only be Thursday. Yep.
For some reason, Thursdays are hard. For me, this, like generally for us to staff Thursdays, I don't know why people don't like to work Thursdays. They don't. So like Thursdays are harder to staff. I don't know why. What? Yeah.
I think from our standpoint, we really do need the fourth cohort. We hire a lot of December grads, starting on February is too soon, and starting on in, July is way too late.
Mhm.
So I appreciate that aspect of it, but I can, yeah.
Well, we can think on it, and there is a survey, so you can give me your other ideas and feedback too.
So maybe it'll be better.
Yeah.
I think at least.
Yeah.
Do you know how many apartments have like cohorts of the staff? I only have 1 right now. But like, for example, like right now we have 6 people in residency or 7 in every single group I have, like that are currently going to residency right now.
It's not like
So
it's
it's
gonna,
large.
not gonna affect Mr. Telly too much, or keep her, and once we don't have any.
And it's on 1 day, which is really fun.
If you guys don't already. But the critical care is starting this for December grads, we're in Copeland.
Yes. Really?
What? Nobody has done any December grad apps. Seriously.
I have 1 hired.
And I have one of the PPP. Other than that, like, they're not even coming in. Yeah, so I don't think it's gonna hurt at all, but that's interesting, because this is our first one ever. I don't have any others, but first. Yeah.
And
Thanks for going there.
So I guess we're just talking it through on that there's not really many December graduate applications for MedSurg Tele, so we can trial this first cohort, see where we're at in May, which would be the next, May 3rd is the proposed start for the next cohort. And then from May, the next one that would start would be August. So May, June, July, August, right? Is that right? Yes. I did change a few of those start dates. So May to August might work out to separate them a little bit. We'll just kind of see. Hopefully, starting a new cohort every 3 months rather than 4 helps with numbers and spreading things out. Okay, so then I got some feed.
Sorry, I thought of one more question.
Yeah.
When you were talking about champions and stuff, would we have any say in like not letting, say I met 4 residents that month and not letting them all make the same thing?
Yeah,
So I could spread them out over
yes,
what I already have?
yes.
Okay.
I think that is, we would want your feedback on that for sure. So I'll talk about a little bit about the proposal of the champions in these next couple slides, but I did want to show you some feedback from the current residents that are in spring, and this isn't from any med-surg tele, unfortunately, because they have residency next week, but this was from critical care and maternal child service lines. So did you find that the residency program was beneficial? Yes, 100%, which was fabulous. Are you involved in a committee? Most said no. And then if they answered no, I asked why, and they said they haven't been offered the opportunity, they don't know what committees are available, or they have no interest. So just some data to collect, I guess, from their standpoint. I think not being offered the opportunity or knowing what's available, I would argue with that a little bit, but hopefully that's, yeah? Okay.
But we're trying to start it again, so I'm not surprised at all.
Yeah.
Yeah, right.
I know, there's a lot of committees. So,
Also, you know, once they decide what committee they want to be on, they should also be given a list of what are the expectations.
Yep.
You know, for audit or rounding or
exactly,
that kind of thing.
yes. So hopefully changing those haven't been offered the opportunity and knowing what committees are available, we can change that in residency. So day 1 of every start date of the cohort would kind of look like this. I would go through the expectations, the policy and requirements, give them a little presentation on that. I'd want to invite the market directors and CNO just to introduce. I feel like knowing who is in charge, I guess, is important, and knowing who you can go to and just having a face with a name. So I'd want to invite them to just do a quick brief introduction. Then the committee leaders of all the committee groups that are listed on your agenda, and for those online, I'll show in a second, but they would all be invited to present what their committee is, what their expectations are within each committee that they have, and then just kind of do a little cheerleading and promoting their committee to encourage joining. We'd have the residents have a top 3, desire to join, and then we would divvy out accordingly. We don't want, like Jackie was saying, we don't want everybody from one unit to go to that meeting, or maybe that unit doesn't need a whole lot of Kali champions or whatever. So we would be able to divvy out appropriately based on their interest, because I think that's important. We don't want to shove somebody into something that they have no interest in doing, but their interest, and then also what the needs of each department are. So that would probably take a little bit of work to organize, but I would want your feedback too on what you guys are looking for too. We also would just ask that no more than 3 to 4 residents per cohort are joining the committee, so that we can divvy out the love to all committees that are there. So then that leads into the project expectations, and I think I gave you guys a handout on that. So I will send this out when I send out the meeting information, but we would want them to come up with an evidence-based practice project that they're going to decide on by month 5 of nurse residency, and I'll give them a concrete date of when that decision is due. We'd want them to have some supporting references, so at least 3 to 4. If it's something that maybe is a newer topic and they can only find 2, we'll be a little lenient, especially this first cohort, this first year. I think it's a lot of trial and figuring out what works, what doesn't. We would want the nurse resident to work with the committee leaders to identify what gaps exist within the unit or organization. We want them to improve quality metrics and impact their key results that exist. So like I mentioned earlier, we'd really want that committee leader to mentor that nurse they aren't going to know what the problems are that exist. They're really new nurses, right? Because we're asking them to go through this residency program as a new grad. And so they don't know what exists, and they can't know. So we need to mentor them. During month 11 of residency, we present the poster fair or presentation of their project. They would set up in a room. I'm not sure what we have reserved, but then I would envision leaders, committee members, committee leaders, co-workers to just kind of come through and see what work was done and what the project consisted of. Was it impactful? Was it something that didn't work? Just to share, because I think we want to display their hard work too. For those online, I'll show you really this quick handout really quick, and like I said, I'll send it out too. Does anybody have any questions on that piece of the expectation?
I really like this. I think just like you have expectations for the residents, it would be nice to have expectations for the leaders. But as leaders, that we're all consistent, that we are doing what you are wanting us to as far as meeting with them or things like that too. Yeah. So Abby was just saying having expectations for leaders so that we can all be doing everything the same. I'm kind of just really quickly scrolling through this so you can at least just see a lot of this is really on the slide that I included. Would you like me just to type something up and send it out so you guys can see, or would you like to provide me with some expectations? How do you want me to go about that? I think however you want, how you envision our role with the project.
Okay.
Just let us know like what things you're expecting of us to either communicate with them, help with them, provide them, that kind of stuff.
Awesome. Great. Thank you for the support on that. I will get something written up and send it out to you guys to see what you guys think. Perfect. Thanks, Abby. Okay, so then we would want our committee leaders, and they have seen this expectation as well, but we want it to be standardized, of course. So attending 75% of the meetings, a lot of that is already a requirement within, if you join their committee. Audits or rounding, they need to do at least 7 to 10 a month, and that's already included in their expectations. They do need to provide feedback to you guys if issues are arising or they're not participating, they're not attending the meetings, or doing what is asked of them. So they are supposed to be in good contact and communication with you as well. So I envision this as a whole team collaboration to help these residents become successful and more involved in our organization. They are supposed to mentor like we talked about, and help them identify what the need is for a project, and then encourage them to share the progress and updates in the committee when the meetings are held. So these are the committees or the unit champions that we have come up with. If there's anything additional, please let me know that we can always add committees as long as there's a leader for that committee to be present and be able to be a mentor for our residents. We tried to include as many things that would be beneficial for our patient outcomes, for our key results, and tried not to make more work for our educational team that already, I don't know, that doesn't maybe sound good coming out, but I think it's good to include all aspects of our organization that are already doing a lot of this work, and let's just get the residents involved to owning some of that practice.
And no, there's not currently champion forum that you can champion one. But they are both on board with the mentorship process in the process. And so they'll have. I will say. It's time to people to do their good stuff.
No, that's right here.
Pointing.
The guy who's champion before, right, stuff.
Point of care.
Point of care,
That's
yeah,
right.
my champions renew all my people.
Our, and the diabetes champion, when we had it, didn't fight for it. It was not.
Okay, that's good feedback.
We started with care. It just, we had a diabetes champion, and she was like, the work they do is completely not even.
Okay. That's good to know. Some of the, like, that would be, I would want to make sure nobody from a critical care area is signing up for diabetes if it's not applicable. That's good to know. The other discussion that was going on was just that Diabetes and Pain Champion, they don't currently have a formal committee, but they were on board with supporting a mentor and coming up with something that is going to be beneficial for the organization as far as a evidence-based practice project. So yeah, that's a great feedback. To if there's something that doesn't necessarily apply to your unit, please let me know that. That would be a good thing to watch for to make sure we don't assign somebody to that. Okay, so this is the voting, I guess, QR code, and I will also email this out to you all once I include this, everything we've talked about and discussed, and you guys can vote on the proposals that were presented. So what questions, comments, feedback? Anybody online?
So if, other than that, I'm a little concerned that the people that we're hiring now that maybe take boards in January are gonna be off orientation by really March, April.
Which that's the idea, Chris, but that's what we're wanting, is have them kind of.
Off of orientation.
Because how it is right now, they will start in July. Unless we add this work one, then they're waiting until July.
Okay.
Because February is too soon for them to start, they're like, really,
I just
start like the week after. Yeah. Because of vacation, that's a lot, like, I mean, like, so.
Yeah, oh, totally, I know, that's why we don't put people in that. I just wondered if May was too small.
Yeah, May was kind of the happy medium, I guess, between July and February. Is there anything else?
So, okay, so do you guys have anything for February then? February cohort?
By December, grab the path forward quickly and get started.
Does February cohort would be very small then?
For MedSearch Tele, February cohort is looking very tiny.
But is that including like all of these December grads?
No. But there are 8 from each. So that's what tells us. Yeah.
I think I'll have one. That's not great.
You only have 3 regional school and 2 Americana, so 5.
I'm a kitty kid.
And you have 1, yeah.
No, I mean,
But
I don't
you
think
feel less.
super anxious about not having 2 days anymore, and one is Monday, but it doesn't, I mean, I don't have the numbers in my group to support students, so.
Not right now, but I hope to in April.
But that's where we got the 2 days.
Yeah.
Because we're like, can't possibly staff support, like all the rest.
Mm-hmm.
So we have a lot of open positions still then. There, yeah, the only reason we have staff on the floor is because we have hundreds of practices. So, I mean, yeah, we don't have our own staff. Well, some of us do. Kind of,
I love that. I would staff the matrix with my people that consistently pick up extra shifts. But if they don't, or by a lot of vacation, I'm not.
Okay. Anything else? I'll give you guys some time back, which is kind of nice. Thank you so much for listening and supporting. I think the residency program is a huge benefit to the new grads. And so I appreciate the support that I feel from you guys as leaders. So, okay. Have a happy holiday. Goodbye to everybody online. I'm going to hang up.
Bye. Great job.